Hi, today I'm going to be talking about the San Francisco fire and earthquake of 1906. One of the most powerful and deadliest earthquakes struck San Francisco, California, early on the morning of April 18, 1906. The earthquake was felt all the way from southern Oregon to Los Angeles to Nevada, but was most intense and caused fires in its epicenter of San Francisco. It lasted less than a minute, but the immediate consequences of the earthquake were severe as several fires erupted across the city, lasting for 3 days, damaging over 500 city blocks, killing about 3,000 people, and ruining the homes of over half of the 400,000 residents. Despite the city's fast military response and aid from the country and world, people dealt with weeks of difficulty and hardship and relied on outside aid. Relief efforts were necessary in the immediate aftermath and were carried out by government, the army, volunteers, charities, communities, organizations, etc. Public health efforts emerged from the disaster, and the first involved taking care of the injured. Many people were hurt, but hospitals and emergency rooms were destroyed. The injured were evacuated to the Presidios Post and general hospitals in the far western portion of the city, but they quickly overloaded with patients. Therefore, physicians and nurses from the destroyed hospitals, as well as volunteer physicians and nurses, cops, the Red Cross, the Army, and others worked together to provide emergency care to the injured. Semi-permanent tent camps were created to provide improvised outdoor hospitals to serve the sick and wounded and provide outpatient medical care. Additionally, the House and Senate Appropriations Committees passed emergency appropriations for the city to pay for these medical supplies. The next effort involved sanitation and housing. Since fresh water and food was no longer available, sewer lines had been destroyed, homes were destroyed, and infectious disease epidemics threatened the people that were living so close to each other in unsanitary conditions with rats and illness. The city was divided into sanitation and relief districts where an Army medical officer was assigned as a sanitation officer for each district. Permanent refugee camps were also established to facilitate efficient administration of food, water, sewage management, and medical supplies. Within a week, over 100 refugee camps were set up to provide shelter and outdoor kitchens, as indoor kitchens were not allowed at the time to prevent more fires from occurring. The Department of Public Health collaborated with the Department of Public Works, the Army, and volunteers, like the Citizens Committee of 50, to provide safe living conditions. As for sanitation, a hospital was established for typhoid fever patients in case of an epidemic they thought might happen, and measles, scarlet fever, and diphtheria was also treated there. And a separate smallpox hospital was also established, as well as vaccination programs, like for smallpox, were set up at the refugee centers to prevent future illness. Tents distributed by the military eventually replaced by wooden huts for people to live in, and the House and Senate Appropriations Committee passed emergency appropriations for the city to pay for water, food, tents, blankets, and other supplies as well, and they also set aside funds to rebuild several of the damaged and destroyed public buildings. Another public health effort involved the bubonic plague. Since after the earthquake, people were living in overcrowded shelters and refugee camps where garbage and trash had accumulated. This provided an environment for rats to carry the bubonic plague, and actually rat catchers found rats in the area that autopsied signs of the plague. So after the earthquake, people were warned not to violate the instructions of the sanitary officers, but still a bubonic plague broke out in 1907. A highly effective public health campaign was enacted with the help of public and commercial sectors, civil organizations, and the general public to get rid of the rats and transform the surroundings back into what they used to be. Health disparities existed in the relief efforts, however. San Francisco had attracted a Chinese labor as a result of the 1848 gold rush and the western expansion of railroads. However, they were not welcome because they took jobs in valuable land, and this earthquake was looked at as an excuse to claim Chinatown for commercial development. and they attempted to drive the Chinese labor workforce out of the city by segregating them and not giving them proper refugees and housing and medical care. But eventually the city lost tax revenues and profitable Oriental trade, so the Chinese labor community was let back in. And lastly, long-term public health efforts formed from this earthquake, and these include planning and educating about massive disasters like earthquake and fires, and planning for how to deal with hospitals in the disaster, educating about first aid, planning for rebuilding communities, and providing safe living. Also, the goal is to provide education and prevention for disease spread and plagues and address how to handle the disease spread if it does happen.